The last part of Medicare is Medicare Part D, which stands for prescription drug coverage. Without a doubt the most confusing, and given its complexity and the fact that many Medicare beneficiaries will never be hospitalized, but most will buy a prescription drug next month. Medicare Part D is available to anyone who is enrolled in Medicare Part A and enrolled in Medicare Part B. Remember, in order to get Medicare Part D, you've got to enroll in Medicare Part B. The important characteristics of Medicare Part D include a deductible. In 2013, the Medicare deductible is $325. Copay. A copay is the amount of money, a set amount of money you'll pay each month for your prescription drugs. Coinsurance. Coinsurance is a set amount of money that you might have to pay for certain drugs, or possibly coinsurance when I get into the coverage gap or the donut hole. Premium. Premium is the amount of money you pay each month for the coverage. And that varies from region to region, but generally speaking, the average cost of a prescription drug plan nationwide is around $35 per month. The initial coverage limit. In 2013, the initial coverage limit from January 1 through December 31st is $2,970. That is a number of the total costs of your drugs. Very, very important. The initial coverage limit is calculated by adding up the total monthly costs of your drugs times 12 months. If the total cost of your drugs exceeds $2,970, then a Medicare beneficiary finds themselves in something called the coverage gap, or more commonly called the donut hole. When your total cost of your prescription drugs on an annual basis exceeds $2,970, you find yourself in what we call the coverage gap or donut hole. In the coverage gap, as an enrollee, you will pay 79% of the cost of a generic drug and 47.5% of the cost of a brand name drug. So in essence, the government is assisting you, but you as the Medicare beneficiary must pay a greater portion of the costs. The last number, and one of the most important numbers when trying to understand your prescription drug risk, is your out-of-pocket limit, your out-of-pocket expense limit. That number for 2013 is $4,750, which constitutes the amount of money that you would have to pay out of your pocket from the very first day that you had to pay for a deductible all the way through your donut hole. So if the total cost of your out-of-pocket expenses reaches $4,750, then you find yourself at your maximum out-of-pocket, and therein lies the last piece of the prescription drug plan, where the government comes in on a catastrophic level and pays 95% of all your prescription drug costs. When discussing your prescription drug options, there are a few things to consider. One, you don't have to sign up. Unlike Medicare Part B, where you have to sign up to get these other benefits, you don't have to enroll in Medicare Part D. If you don't enroll in Medicare Part D, you have no prescription drug coverage, and at a future time, the government assesses a penalty of 1% a month for every month that you didn't have a prescription drug card. Also understand that every Part D vendor has a different formulary. When you're looking for your prescription drug options, formularies are very, very important. Formularies is a list of drugs that are covered under that prescription drug plan. And again, with 25 to 30 different prescription drug vendors in any given locality, there's lots of differences between insurance company A and insurance company B. Also understand that Medicare doesn't cover all drugs. Every year, Medicare tweaks those drugs that are not a covered expense. We also recommend that you do what we call a coverage gap analysis, which is a simple way to review your current prescription drug costs and compare those either online at medicare.gov or by calling our office, and we actually can create what's called a coverage gap analysis. That allows you to know upfront what we estimate your out-of-pocket expenses are. We also recommend a few items from a consumer perspective. Number one, make sure you ask your doctors for generic drugs. Good news, in the last 16 months, many of the nation's best-selling brand name drugs have now gone generic. If you are on a brand name medication, we normally recommend you maximize your savings by using a mail order prescription drug vendor, which is your prescription drug coverage. And we also recommend that you also try to maximize any additional assistance that you might get from either the manufacturer or from a local entity with help paying for your prescription drugs. Finally, who can enroll in a prescription drug plan? Medicare defines certain characteristics or certain eligibility for all Medicare eligibles. Number one, in order to sign up for Medicare Part D, you must have Medicare Part A and Medicare Part B. You must live in the plan's service area. For example, if you're buying XYZ Insurance Company, we've got to make sure XYZ Insurance Company is marketing their services or their plan in your county. You must live within the United States. If you live outside the United States, you're not eligible to enroll in Medicare Part D. You can't be incarcerated, and you must enroll. You must complete an enrollment form either online or in person or by completing an application. Medicare Part D enrollment is not automatic. For more details, drop us a line or give us a call.